So for those of you, this is Lisa Alberghini from HPN. For those of you who are holding on the line, we're going to wait another couple of minutes before starting. And for the participants to know, you are all on mute for the beginning part of this. And we'll do some introductions and provide some instructions in just a couple of minutes.
We are using our staff updates to start with, and then we're creating resident communications and external communications sort of based on what we said to the staff. We're not doing those communications as frequently. We're actually doing our first full-blown resident communication about specific actions today. So that's kind of our overall plan, and then I'll just talk a tiny bit about what we're doing at our sites. We are keeping our central office open. We are in Alameda County, and we are using the county guidelines. So we are not closing our office. We have three offices in Hayward, California. We are limiting staff interaction at the sites, and we're doing that a few ways. We're basically doing appointment only for our resident services and community offices, and we're doing everything else by phone, but we are allowing residents to meet with us. We're trying to get setups that have the 3 to 6 feet recommended distance, and of course, all the sanitizing gear we can find. We did decide to keep our sites open and our common areas open because particularly in our senior communities, social isolation is a problem. And so we are really clear that the common areas are critical. So we are upping the cleaning of the common areas to several times a day. We are using our janitorial staff and some of our maintenance staff who have a little bit of free time because we are limiting our maintenance staff to emergency or safety related work orders. So that's kind of what we're doing at the staff level. We are also relying a lot on gloves and training on how to use gloves for our maintenance and janitorial staff. We are canceling all meetings at our communities except for 2 key programs, and that would be our food distribution programs and our after-school programs. And we have specific reasons why we think they need to be kept running and that we think we can make them safer, but we are canceling all other trainings and meetings, and we're asking our service partners to cancel gatherings as well. We started with just at our senior sites, and this last communique yesterday, we've decided to cancel them all for the month of March. I should probably say that every action we're taking is for the month of March. In a week, we're going to analyze what we do about April. We figured we better just focus on March right now. We are suspending our annual unit.
No, go ahead. Continue. Go ahead.
Sorry, I thought you were waving at me.
No. I have a question for this.
Hi. We're suspending our unit inspections, the Eden annual unit inspections. We are monitoring our agencies who are making various decisions on whether they are suspending their inspections or not. So that's a moving target. We actually have it changing right now. We're obviously trying to help talk about redeploying staff to projects and alternative tasks. For example, our maintenance crew is only going to be doing emergency and safety work orders, so we're going to redeploy them to help clean our common areas more frequently, that kind of thing. So those are sort of the site area items, and then we're doing some general communication with our staff about being symptomatic and going home and using sick time and self-quarantine if you meet CDC restrictions. We're modifying our 3-day doctor's note requirements. We're making some changes to our gym membership so that it's easier for our staff not to go and not be penalized for not going. So that's really what we're doing right now. We are also making a big push to make sure people understand the protected nature of staff disclosure and limiting anything you find out about someone's health status or possible health status to HR only. And it's critical, you know, because there's just some ramifications to that. And then the last thing is we're doing all of that now, and we are planning actively for 2 scenarios: remote work for our central office. So we are really gearing up for who can technically work at home or work remotely in a safe, clean site, who can actually do it, what jobs can't really be translated to work at home. We're looking into a program out here that is a work sharing plan. So if you have employees that can't work full time remotely, they have some unemployment benefits that might be possible. We just learned about that yesterday. And then of course, we're planning for what we need to do at our sites as county guidelines change, and do we need to lock down the sites further? And that's the one that's, right now we're limiting exposure of outside agents to our offices, but we may have to go further.
Great.
Yeah, I think that's the general sense.
Okay. Thank you, Meg Monique. That's really, really helpful and comprehensive, and particularly in terms of from kind of large and small ways, how you're dealing with residents and staff and trying to keep people engaged, as you said, especially in the senior site. So we really appreciate that. We're going to go next to Michelle and Cheryl from Mercy Housing. Before we do that, let me mention two other things. One is that we are recording this so that if people want a recording later on or can't hear it all, that will be available for you. The other thing is that, again, we've muted everybody else, so we assume you can hear us. If you do have a problem, maybe you could email Manuel, or you could use the chat function. That's a good idea. If for some reason you cannot hear us, just use the chat function on Zoom and we will learn that and try to solve the problem. But I think everybody is able to hear us. So again, thanks so much, Meg Monique, and we would like to switch now to Michelle and Cheryl from Mercy Housing.
Great. Can you all hear me?
Yes.
Good.
Yes.
Excellent. Thank you. So you might notice I'm not in an office. I have just returned. I'm the Chief Operating Officer at Mercy Housing. Hi, everybody. I've just returned from vacation in Japan and came back to a self-quarantine for 2 weeks. So I'm living it. Yay. So I want to thank you for the opportunity to share what we're doing. I'm going to ditto a lot of what Meg Monique shared. I think a lot of organizations are taking similar approaches, and Cheryl is available on text, so she's going to text me if I miss anything. We have also heavily relied on our peer groups within the the states and the communities that we're in to share some ideas, and MidPen has pulled together some really nice templates that they're using that we've then been customizing for the work that we're doing as well. So again, props to this industry for sharing as much as we do. As Meg said, we are relying heavily on the CDC and public health guidance because we're in as many states as we're in. We're trying to have a comprehensive approach. Each community is responding differently, either with the numbers that they have or simply the fear and how other organizations are responding. So that is driving some of these conversations, as you might imagine, with operations in Seattle, up and down the West Coast, and then in Denver as well now, or where the numbers are higher. We're paying very close attention to what the local public health agencies are saying. And as Meg Monique said, really to be able to refer employees and residents back to the CDC, back to the state public health organizations. We did send the CDC posters. They have some very nice posters on their website in English, Spanish, and in other languages to all of our properties to ask them to please print and post liberally. Everything from the hand washing posters to general hygiene so that our residents have that information available to them and handy. And that really is our first big communication push out to our residents in a formal systemic way, is to make sure that we have all the information out about what's happening. It just anecdotally, we have had a few properties where there have been residents that have been concerned about that they had contracted the virus. Each have been tested and each have been negative. But in each, in a sense, it was a way for us to have a dry run of, okay, how is that resident now getting to the doctor to be tested? What is the doctor advising? And continuously focusing the effort on the resident needs to communicate with their doctor. It is not our place to intervene. It's not our place to provide medical advice. We can help facilitate that process, but it doesn't mean that they're getting in the car of one of our staff and being driven to the doctor's office. So how do we work with public health to assist that resident to getting what they need in a way that maintains the safety of our staff and also the safety of other residents? We have, as an organization, limited air travel. Air travel must be approved by a senior leadership team member before someone can travel, and we have canceled our large group gatherings. We were actually scheduled to do a series of big town hall meetings across the country. Now imagine you have 300 employees in one room and they're all site staff and one person tests positive. Now you've quarantined the entire region. So from a business continuity standpoint, it's just unfeasible for us to be able to proceed with those town halls. We are, like Meg, doing this on a month-by-month basis. So on a rolling monthly basis, we're relooking at other convenings that have been scheduled, large property management or resident services meetings, as well as large conferences that our leaders are expecting to attend. So we are looking at that. We are not limiting local travel or driving or hotel use. So regionally, our staff can still get to where they need to get to. And so with senior leadership team approval, if needed, then someone can still get on a plane. But again, this is our effort to try to maximize this sort of a resource, a virtual meeting, and try to contain where we can. We have a task force that's been formed internally. So that is consistent of members of the executive leadership team, our marketing communications team, as well as some members from the regions, so that we convene formally weekly, but certainly we're in touch nearly daily. After those weekly meetings, there's a communication then that goes out to residents if needed and to staff if needed. So we then focus our efforts on getting out those messages and communications in a thoughtful way. We're trying to be really deliberate and not swamp our residents and staff. They're already getting a lot of emails about this. We're trying to be really deliberate about sending out information in digestible pieces that aren't too overwhelming, but that also aren't coming out every 5 minutes. We also are sending those communications to all the third-party resident services providers that we work with. We're going to formalize that process this week, so that whatever guidance we put in place for our staff, that they understand that it is expected that their staff would also be compliant with those expectations around communication, around hygiene, around meetings and travel, that sort of thing. We have been asked by some staff about masks. And this has been a rather controversial topic, I think, among Americans in general, right? So there's messaging from the CDC, please do not hoard masks. Hand washing and the like is sufficient. So we have been pushing back when employees or residents are asking for masks. We are not providing them because current guidance is that those masks need to be available to healthcare providers. And currently there are shortages in some communities, and we need to make sure those masks are available. Also, based on how they're worn, they may not even be as useful as individuals expect them to be. We'll be watching that guidance, and especially guidance around seniors, very, very closely over the coming weeks and months. Our senior properties, as far as gatherings go, we are asking folks to perhaps convene seniors in smaller groupings, not the entire property, but again, like Monique said, that social isolation is our greatest concern for our seniors. We are continuing with out of school time programming, but we are trying to hold off on all resident meetings where possible. Otherwise, it really is business as usual for our site staff. And I just saw that Cheryl jumped in as a potential panelist. So Cheryl, is there anything else you'd like to add about the properties that I've missed?
Well, I would, we do have a number of things that, hold on a second here, I'll start my video.
Look at you.
A number of things that we've incorporated into our business as usual. For example, we do have monthly site safety meetings. And so our safety meeting for March was washing your hands and using gloves, which we incorporated into our normal course of business. We have also established enhanced cleaning procedures and processes throughout the properties. And I don't know if you all are experiencing this, but getting your hands on hand sanitizer and cleaning supplies can be challenging. We have had our first property where people refuse to come to work because somebody's been quarantined, which is creating the challenge, as Meg talked about. How do you staff a property, you know, when there is some resistance to being there? So overall, with our employees, I think we are changing our policies and procedures to accommodate the situation. We also have become more lenient on, we have a policy that if you're going to be off 3 days, you need a doctor's note. You need a doctor's note to come back. We've kind of tossed that aside for now. because we do want people to stay home if they're sick, whether it's coronavirus or the flu or a cold or whatever. So I think our biggest challenge now is just having everybody settle down a bit and understand the panic seems to be, and as Michelle said, we are in many parts of the country and have to adapt our approach based on what is happening in the local environments. As far as working from home in the management company, a lot of us already do, so it's no big deal. Michelle's going a little stir crazy, I can tell you, being quarantined there, but we only have one office now in Seattle where the local health department has encouraged folks to work from home. So as we, gather information, we're trying to be flexible enough to have an approach that is consistent across the portfolio, but adaptable to each regional situation. So it's been very busy here.
Yeah, I'll jump in. We've also asked our leaders to do a quick inventory of which employees might need laptops. Our systems allow our office staff to work from home 100%. We have everything loaded up on SharePoint in the cloud. So in theory, as long as you have the right equipment, you'd be able to. And we're finding just a handful of departments that do need laptops. So we're resourcing those teams so they can work fully from home if need be. But as Cheryl said, a lot of our communication with our site staff has been, you are essential. The work that we do protects and supports a very vulnerable community, and especially in these sort of situations. And so we need you. We need you to be at work and be focused. And that can be really hard when the panic starts to hit a team. Lastly, we are setting up a SharePoint site for FAQs as we get questions in about masks and the like, just so that folks have somewhere central to go to. A lot of that will be liberally linking back to the CDC and public health resources, but just so that we have another place for people to go if they have questions.
Great. Well, that was really helpful. You were done, I think?
Yes.
From Mercy, Michelle, and Cheryl. That was really helpful. And each one of the properties, and I think the organizations have a little bit of a different twist on this and a little bit of a different approach. So it's really helpful to get a couple of examples like that. I know we're going to have a lot of questions. I've been writing down mine already. So I think we'd like to turn now to Stephanie from the Community Builders, and see, Stephanie, if you could share some of your experience as well.
Sure, I'm happy to. Again, my name is Stephanie Garrett. I am Vice President of Communications and Fund Development for TCB. I'm in Boston, and our footprint spans 15 states and the District of Columbia, all east of the Mississippi. So the temperature here, I would say, is probably a little bit cooler than what we're hearing from our partners on the West Coast. The numbers are smaller. I found in my role as communications lead on some of our milestone events, introducing the topic to local, managers and local teams that have not really formed opinions or had this on their radar. So I think that is changing quickly. But I did just want to point out that broadly speaking, I think some of the Midwestern and East Coast markets where we operate are, sort of lagging indicators of what is to come. We formed our coronavirus task force on February 26th. Representatives are myself, our head of property management, human resources, as well as our community life resident services. So that's the core team. We convene on a daily basis. As has been shared, the CDC has been our main resource because we cut across 15 different states and the District of Columbia. We've relied on that primarily. One of the first things we did was actually launch an intranet site. So that is only a couple days younger than the task force itself and has become a repository for lots of links. All of the communications that we're sending out are being posted there. We have communicated once to all TCB residents, both at the sites that we manage and through our third parties. essentially informing them of our existence as a task force, underscoring the clean, healthy habits that the CDC has outlined, and letting them know to expect more information and updates in the days and weeks ahead. Since that time, we have had targeted communications under special circumstances. So when the city of New York, when the state of New York declared a state of emergency, and the New York City subway system, they were given very specific tips about what to do when a full subway car comes, to wait for the next one. And so our New York City, our Manhattan staff, had some specific concerns that came up over the weekend. So we did communicate to the New York City, New Jersey portfolio specifically. Just within the last day, we have also communicated to all of our senior restricted sites. We are keeping our common areas open, but we have suspended programming in our senior sites through the first week of April. Our interpretation of the CDC guidelines was, that for individuals over 60, there is not an advisable way to gather in groups. And so we are suspending that practice and plan to revisit that in the weeks ahead. I guess the other thing that I would share is that we have been in contact with our insurers, anticipating the issue that was just raised about refusal to work. There are worker protections through OSHA if you are asked to perform work that presents, an imminent risk to your health or safety. So we've asked for outside guidance on what that means in the context of coronavirus and really how to walk that line. We have not changed policies with respect to travel. So we are still proceeding with, business travel that was previously scheduled. I think that with some of our events, this is a very busy time for us on the development side, ribbon cuttings, groundbreakings. And for the most part, the mayors and the governors are full speed ahead. They want their scissors, they want their shovels, they want to be there. There was an issue with a donut wall in Chicago that was proposed, sort of open air donuts on a board. And I think perhaps it just speaks to the resilience of the Midwestern spirit, but I actually had to sort of flag that for the team as a terrific idea under most circumstances, but working with that vendor now to have some sort of a boxed single serve alternative. So I say all that to say there's a real wide range across our portfolio, from sites that want open air donuts to sites that are concerned about getting on a subway car that's too crowded. And so we're really trying to address those specific issues as they arise, and give a common standard of expectation for our residents and for our staff.
Great. So that's really helpful, Stephanie, and some interesting examples. And I think one of the things that this shows us is, well, there are a couple things. One is that organizations deal with things a little bit differently. Some have no travel restrictions, some have limited travel restrictions, some have no programming, some have limited programming, or they're changing the nature of that so that there is, we're careful about social isolation. It also, I think, points to the fact that it can be really different and vary across your portfolio, particularly when you're in, a lot of places, which these organizations are. That may be different, a little bit different than an organization that has a more concentrated set of properties or sites. So I think what we'd like to do now, I do have some questions, but I'd like to open it up to others as well. And we will take people off mute and ask that you mute yourselves. And if anyone has an excessive amount of noise coming from them, we can mute you on our own. So, so follow the rules, please.
That's all set.
And as we get people off of mute, if you do have a question, please feel free to speak it, identify yourself. If a few people speak at once, we'll try to manage that. Or you can again give us a thumbs up or let us know through the chat. I do want to ask, maybe at the outset, if we have anyone here from Seattle on. Is Susan Boyd here, or Jill Fleming from Capitol Hill or Bellwether? Because obviously Seattle is experiencing a pretty, it's a true hotspot. Just curious if anyone from Seattle, from those organizations are on the line.
People can unmute themselves right now.
And you can unmute yourselves now to speak.
Yep.
Okay, I didn't know that they were going to be, but I thought I would ask that. So before we start with questions here, is there anyone on the line or in the meeting who would like to ask a question? And you can unmute yourself to speak or let us know on your computer.
Hi there, this is Michelle Hawley. I'm from Bellwether Housing here in Seattle.
Great. Michelle, can you describe what you're faced with there in Seattle and also at your properties in particular?
Sure. So we are doing many of the same things that Meg and Mercy have talked about, so that's refreshing to hear. Right now, we're keeping our sites open as well, and educating our staff and doing some enhanced cleaning and sanitizing throughout the properties. So we're also diverting non-essential work orders and potentially delaying work on unit turnover to keep cleaning practices going at properties and intensifying that. We don't have any current reports from staff who are sick and or testing positive for the virus, so that's also reassuring. And at this time, we don't have any reports of residents. So I'm also interested to hear about sites that may have experienced residents that are quarantined, and how folks are dealing with that, because I feel like that's definitely a possibility. We just don't know about it yet. Most of our admin staff are working remotely. We've also put in place a daily stipend for our maintenance and site staff that are working out in the field and front lines to kind of help manage that frontline work that they're doing. They don't always have the privilege to work remotely, so we're trying to compensate additionally for that. What else can I share? Much of the same communications. We've been communicating with residents. All of our sites are located in the Seattle area, so we haven't really addressed travel. I am interested. There were a couple comments about limiting travel. I'm curious if that is just business or if other organizations are advising or limiting personal travel that staff may have.
So, Michelle, thank you for that feedback on what's happening at your places in Seattle. I have a couple of questions. This is Lisa Alberghini from HPN again. I would just say from HPN's perspective, we have not yet limited travel for professional or obviously for professional or work reasons. We have asked all of our staff to report to us whether or not they have travel plans, either for work or personally. If it's for work, we obviously want to hear what the reason is that they're going, where they're planning to go, what the reason is, and obviously if it's, and where they're going. If it's personal travel, obviously we don't need to know much about why they're going or where they're going, but we do want to know where they're traveling to and from. So we have asked our staff to sort of self-report on personal travel, just so that we know where people are coming and going from. And we have not yet suspended travel at the corporate level for work purposes. So that's kind of what we're doing. I think one of your questions was a good one. I'll repeat this and then ask the panelists or others to respond. One of your questions, which I think is an interesting one, is it would be good to know if any of the participants have either staff or residents who are experiencing a quarantine now, and you know how that's being managed, other than I know Michelle, who's self-quarantined here.
So we have had the one property where the assistant manager was notified by the CDC to place herself in self-quarantine. And
This
the
is
rest,
Cheryl speaking.
yeah, this
from
is
Mercy
Cheryl, I'm
Homes.
sorry. Yeah,
That's okay.
and that the rest of the staff has not reported back to work. That is really the only other quarantine besides Lucky Michelle that we have been notified of, but we do have a critical incident reporting process in place. And we've had a number of employees and 1 or 2 residents that thought they had the virus, but did not have the virus. So we really have not had anyone officially be tested for and confirmed with the virus yet. However, the false alarms were very impactful for the residents. We had a property where someone was removed from the property by EMS in hazmat suits. Turned out it was an asthma attack, but it took a day or so before people found out, and it really did impact the residents and staff there. It was quite traumatic.
I imagine it would be. Other participants on the phone who have 2 questions. One, who have had staff or residents who have been experiencing quarantine. Cheryl, that was a pretty significant and maybe dramatic illustration of someone going through that. And then a companion question, I guess, is how have people thought through? I think this was a very good question or challenge that maybe it was Michelle who pointed out. How are people handling just the act of getting residents to the doctor if they have an illness or if they feel like they need to be tested? Are there any other participants first?
We have 4 people that are.
Okay, we have 4 people who would
have
want
questions.
who have questions, and you can, if you would unmute yourself and state your name.
I did just want to respond to that. I wasn't sure if you were directing that to me, to the question of quarantine. We have not had a confirmed case at any TCB location. We did have in the city of Chicago a confirmed case at Rush University Hospital. We partner with Rush to staff an on-site resident clinic at one of our locations. So we host the physical space for our residents, but the nursing staff that rotates through is from Rush. And so when it was widely reported in the Chicago news about a positive case there, we received a call from our alderman overnight, bringing it to our attention. And were then able to proceed and confirm that all of the nursing staff assigned to that clinic on our property had not, they were able to rule out contact with that particular individual. And once we got that confirmation, again, proceeded to continue to operate that clinic during, regular hours under normal procedures. But that's sort of the closest that we've come there. And I think it has, for us, opened up a direct line of communication with the Chicago Health Department. We're in 30 cities, and so, we have not established channels of communications yet across the board, but because of that sort of urgency of that initial question, we do now have a line of communication open there.
That's very helpful. Thank you, Stephanie. Do we have numbers?
We have names.
Names, okay. Can you let us know?
Sure.
We have a question from Holly. She says, can the panelists talk about what, if any, actions they've taken to address resident preparedness, like provide supplies and canned foods, and ability to pay rent if quarantined, schools closed, etc.?
Did the panelists hear that question? Did you hear that all? Okay.
I missed the first part of it.
What, if any, actions they've taken to address resident preparedness, like for providing supplies and canned foods?
So we have not taken any action at Eden. We are just starting to sort of put together a plan for our resident services to do welfare checks, door-to-doors, and then as a part of that, we'll probably talk about, is there something else we should do? What resources should we be able to offer at least? We have an information referral line, and we're trying to figure out how to have them really be involved in that as well. So we haven't done anything yet, but we are looking at what should we be doing ongoing with resident welfare checks and the corresponding questions that arise about resident needs, et cetera.
And that was Meg Monique.
Yeah, sorry, that was Meg Monique.
Okay. And Stephanie or Michelle, Cheryl, do you have anything to add about what you're doing to help with resident preparedness in terms of providing food or other items?
This is Michelle, jump in from Mercy Housing. We're in a similar situation of really just assessing what we think we might need. Some of our properties have stocked pantries, others don't. So it really a matter of looking at it property by property and asking our resident services staff to take the lead there. We did discuss about school closures in some detail because it's come up already in Sacramento. So what we are going to be looking at is continuing to offer out of school time programs during this time, just as we would with a snow day or any other sort of a closure. And similarly for staff that would be affected. I mean, the good news is that all those school closings so far haven't landed in our space, but we wanted to make sure that we're explicit about the conversation about out of school time because a lot of our residents will still need to continue to work. So at least that's our first pass at it.
That's great.
We're
doing the same. The two programs, we're not suspending our food distribution and after school programs for that very reason.
Great. And Stephanie, did you have?
So as I mentioned, the only programming that we have decided to postpone is in our senior properties. Our other programs are proceeding as usual. We just notified our older residents yesterday about the topic of preparedness. So it's been less than 24 hours that they've heard from us about being prepared with medications, with food items, things of that nature. And there was a general guidance to call property management if you are feeling unwell or have difficulty contacting your doctor. And we're just now starting to think through in a more substantive way how to be prepared to help residents prepare.
Great. Okay. Holly, I hope that answered your question. Omi, do you have a second question that you can read to us?
I do have a question here from, A. Odina. I'm not sure what the first name is. Have any members requested rescheduling of I'm sorry if I'm getting this wrong, REAC inspections? REA inspections and follow-up to REA inspections, and what has been the response from HUD and REA?
So I will take that. At this
Cheryl.
point this is Cheryl. At this point in time, our REACs and our MORs are proceeding as normal. There's been no change. HUD is still scheduling them. We're still showing up, and it's business as usual for the most part.
Great. Is there anyone else, any participant who has an experience similar to that?
We've got the same communications from HUD. Reacts and Mores are continuing. We reach out almost every day and ask, and we get the same answer.
Interesting. Okay. Omi, do you want to read another question to us? And I have a couple when you're.
Sure. Another question is, how are you ensuring the enhanced cleaning is getting done? Do you have schedules that you're adhering to and initialing?
So this is Cheryl again. I would say that with our number of properties, we do not have a system for making sure people are doing their jobs any more now than we do on most days. The supervisors are responsible for having the managers do the enhanced cleaning, and each property based on need. For example, senior properties, you might clean more often, or on a property that has one common area versus a garden style apartment. So it's really up to the supervisors and the managers to ensure that the enhanced cleaning is adequately done.
Great, thank you. I have two questions maybe while we're waiting for other participant questions. And the first is, I don't recall who mentioned this, but my question is, are you still having resident service coordinators or sort of third-party vendors come to the property? I know, I think, Meg Monique, you said that you are continuing to meet with residents on an appointment basis, and otherwise also observing the safe space, 3 to 6 feet distance. But the question is, have you suspended resident service coordinators' work or any other third-party vendors?
No.
Looks like
No,
so.
we haven't suspended it. We are, and these are the questions that are really starting to come in now. Are we still doing one-on-one resident meetings? Yes, we are. We might do them differently or in a different space to make sure it's safer. Appointment only if possible, so we can kind of prepare to only have one person in the office at a time. But we're still using our resident service coordinators, and we are, as we cancel trainings and other services, we are just guiding them to project work or a little bit different work.
Okay. And I think just so that for people on the phone, both Stephanie, Cheryl, and Michelle also the same thing, that you're not yet canceling, I believe, resident service coordinator work with the residents.
Correct.
Yes, this is Cheryl. All we have recommended or put in place is that large resident meetings with more than 8 to 10 people, that we try to keep those groups low, to still be able to interact and communicate. And that's one of the things we have done with preparing the residents, is we have had, especially in California, small meetings to talk about what's happening, but larger groups. So your monthly, resident service meeting with perhaps 30, 40, 50 people, we have deferred those.
Okay, great. Obi, we'll go to another question from the participants.
Cheryl Du Bois has a question. She's on the line.
Cheryl?
And Cheryl's from Bellwether.
In Seattle.
Yeah.
Cheryl, are you on the line?
There you go.
Are you there, Cheryl?
You may be, are you unmuted, Cheryl?
She's on our.
Okay.
Yep.
Okay.
So I do have a question from Carmen Hancock. What stance have others taken with regard to our responsibility to notify residents and/or staff in the event of confirmed infections in residents and/or staff? Are community-wide notifications being made in the event of confirmed infections, keeping confidentiality and privacy in mind, of course?
So I adjusted my settings. Can you guys hear me now?
Yes.
Yes.
Okay, this is Cheryl Du Bois. I have more of some comments than questions. So first of all, I'm the COO with Bellwether Housing in Seattle, and we have suspended resident on-site interactions. We have, as Michelle Hawley mentioned a minute ago, we have site managers on site and we have maintenance staff on site, but resident services are supporting residents remotely. So we've given people both their phone number and email. Our site staff are not going into units. Our local housing, City of Seattle Office of Housing has suspended their unit inspections. We've told maintenance staff not to go into units unless there's an emergency situation that needs support. So we're definitely doing a lot of things to limit those interactions. We're also reaching out to all of our funders to talk with them about extended vacancy costs that we expect. We're allowed to use our operating reserves, which is pretty unusual in our local area, to support some of the losses we're experiencing because of our higher costs of vacancy, our stipends that we're giving employees who have to be in the office and working right now. So we're doing a lot of outreach and advocacy to get support from our local funders for what we need to do right now.
That's very helpful, especially I think, I mean, the comments particularly around, what do you do if for rent payments and other, just and working with your funders, I think is something that's going to be coming up more and more. And we'll need to kind of get ahead of or get on top of. So that's extremely helpful. Thank you. Are there other participants? I think, Omi, you had read one question. Shall we go back to that one and then open it up for additional comments also or questions by participants? But Omi, why don't you read that one more time?
What stance have others taken with regard to our responsibility to notify residents and/or staff in the event of confirmed infections in residents and/or staff?
So the question is, what do you, and I'll place this first to the panelists, what is your position around notifying your staff and residents if there have been confirmed cases in or, related to your property operations?
This is Michelle from Mercy Housing. I'd say first and foremost, we take our direction from the local health department. They will, and what we've seen, they will come and get the individual, right? Get them into testing, get them to a doctor if need be. And then they tell us really what we can communicate, what we should communicate. And often their direction to us has been pretty clear. So up until now, we've really taken their guidance in any communications that we've done. And to Meg's point earlier, there's really a confidentiality element here. You'll notice that the reports, there's not a lot of public shaming going on, and that's really intentional because this thing is has a potential to have a lot of infections. We don't want to start to stigmatize individuals. So I think it's really important that we, like Cheryl said, sometimes there's a big to-do and a fuss, and you can't help but the whole property know exactly who was just taken out on a stretcher. But where we can, we need to be really responsive to the local public health guidance.
And this is Cheryl. Here at Mercy Housing, we do have a protocol for notification of serious events, whether it's a criminal event or some other sort of unfortunate thing that happens, to communicate to residents in coordination with our legal department to notify folks and without much detail, but something has happened, here's what you need to do, blah, blah, blah. So it's would be part of our normal communication anytime there's a serious event.
Great.
I don't know if I think perhaps we're getting some questions just directly to the panelists in the chat box. There was a question about how we're notifying residents with paper, flyers, email.
Do you want to respond to that, Stephanie?
Yeah, I'm happy to respond to that. We have been using a combination of flyers, copying flyers, but also postings. And so we have posted, the traditional CDC, good hygiene posters in places you would expect, near hand washing and things of that nature. We also have posted yesterday's guidance for higher risk individuals in gathering areas. So I mentioned earlier that we're postponing our programming in senior buildings, but keeping the common spaces open. In those common spaces, we now have postings advising them of the CDC guidance on higher risk individuals, including those over age 60, and advising them against gathering in crowds. So those have been the two methods we've used. I will say that particularly here in Boston, there has been a lot of feedback around translation. So we have been able to translate pretty quickly from English into Spanish, but we've gotten requests just in the last 24 hours for Cape Verdean Portuguese, Haitian Creole, a number of languages that are pretty significantly represented here in Boston, but not widely spoken across the country. And so the onus is a little bit on us to figure out at a local level how to make these messages accessible in some of our communities.
That's helpful. There's going to be a lot of that required, and just lining up the resources to do translation and get it done quickly. And it's going to be, I'm sure, this is Lisa speaking, sorry, quickly and kind of continuously, because it will change. Situation's going to change. You're going to need to have access to those translation services pretty regularly, I would think. Other questions from participants? Omi?
Yes, another one from Maureen Peterson. In the context of a single room occupancy environment, if one individual becomes ill, would we be responsible for moving the other residents to a safe environment or a hotel while decontamination is attempted? And would any insurance coverage be available to cover cost of cleaning and alternative housing?
First, do any of the panelists have any feedback on that?
So the guidance that we were given initially from our insurer was that the scenario you described would not be a covered event. I'm curious to hear from others if they've encountered that or gotten other guidance.
This is Michelle from Mercy. That's consistent with what we've heard. This would not be a covered event if we need to bring the building down. I think our expectation would be that we would still focus on sanitizing as much of the property as possible and work with our residents in their units. And that gets to be a very, very tricky dance, of course. But no, I don't think there's an insurance coverage for this either.
So it sounds like on the insurance, this is Lisa speaking on the insurance question, it seems as though it's not a covered event, the little bit that we've heard so far. And I'm going to ask the participants on the phone to chime in here as well. But the other part of the question was, if someone in an SRO, particularly in a unit like that, becomes ill, are we obligated, or what are people's thoughts about kind of getting the rest of the people out of the building, right? I mean, this is where it's so tricky to be owners and property managers, because you're in a really different situation in terms of protecting the rest of your residents as well. Are there people on the line who would like to comment on that? And if so, just you can unmute yourself and identify yourself. And if not, we'll go to Cheryl. I think, Cheryl, did you have something to add here?
Well, I was just going to say that, in the likelihood of an SRO or any densely populated individual building, the CDC will come in and give us guidance. And there would be a possibility that everyone would be quarantined in the building as well. So I'm not sure relocation will be required or necessary. But again, the CDC will tell us what to do, and they will talk directly to the other residents. And so far it has been a little bit impressive on how they have on our, false alarm cases reacted.
Mm-hmm. In what way, Cheryl? How did they react in those false alarm cases when the EMT took the resident out on?
Yeah, so there was calmness. This person's going to be tested. We will get back to you. Now, for the people on the property, I imagine it was like, time marched very slowly for them, but they did get back to us relatively quickly the next day. And on the other incident where someone came in contact with someone that was infected with the virus, they were all over it with that individual and notified her and took care of the whole thing. So they're going to give us direction on how to manage the situation once a case is confirmed.
Yeah. I think a related question, this is Lisa speaking, a related question that came up in my mind when I think it was maybe Meg Monique who was speaking is, I think perhaps you said that you haven't yet started to think through what needs to be done in the event of like a total property, say, lockdown. If you do have a resident who's been tested positive, if the other residents are required then to be quarantined or self-quarantined, have you started to think about plans for that? What does that mean for food? It's a little bit related to an earlier question, but if anyone has any further thoughts to share on that, that might be helpful.
I have to confess I haven't had an opportunity to dig into it, but I will say the most detailed guidance I've seen around multifamily SRO protocols has been from the New York City Health Department. With the declaration of emergency over the weekend, there were additional materials released at the city level. And I think because, you know, Manhattan is just sort of oriented around multifamily living, it even gets into, you know, a shared bathroom setup versus, you know, private bathrooms, you know, how the health department would treat those cases differently if a confirmed case had access to a separate bathroom facility versus not. So, you know, it's encouraging to hear that the CDC on a case-by-case basis provides good leadership. But in terms of helping us think about what to think about, I would say that the New York City Health Department website on this topic gets pretty deep into the kinds of environments that we're working in.
That's great. That's helpful. I think we have a few more questions from participants. Omi?
Yeah. Beverly from AHC is wondering if the mid-pen templates that Michelle from Mercy mentioned can be shared, and what exactly is included in the templates.
I'm happy to share with you how we've gone in and changed it. This is Michelle. Basically, it's a whole bunch of if-then scenarios, much like what Stephanie was just walking us through. You know, if the schools are closed, what will we do for employees and residents? If there's a confirmed cluster of community spread, what would we do for employees and residents? If there's a mandatory quarantine. And honestly, it's a working document, but it's a whole lot of if-then type statements that help you as a team think through how you would respond. So I'd be happy to share it with the team at HPN and ask you all to distribute it if you'd be comfortable with that. Not saying that it's, you know, it's perfect, and we're in the document daily making changes based on what we're learning. And so, yeah, but happy to share it.
Yeah, this is Cheryl. It's more of a roadmap that can lead you from, hey, current status, this is our approach. If this should happen, it would be this approach plus this, and for both residents and staff. And it allows you just to keep track of everything in one place.
Yeah.
Okay. I think, is there someone on the phone trying to speak? No, okay. I think before we go to the next question, Michelle, that would be great. This is Lisa speaking. What we will do, one of the questions that we had, and on the agenda that you may have seen after the facilitated discussion, we were going to speak about potential resources. One of the things we will do is if people have resources that they think are good or templates. In particular, there were some templates that Michelle also mentioned around this, even like CDC posters and other kinds of things that you can post on your properties. If you have those and can email them to us, to Manuel, then we will find a way to then make them available to the rest of the people on the call. So that would be a great help. I know a number of people have asked about checklists, templates, roadmaps, and so I think that would be very helpful. I know Eden has done a lot in general around just emergency preparedness in general on this score. So we will collect those and we will make those available to people. Omi, was there another question?
Yeah. What are organizations doing regarding volunteers at the site?
The question was, what are organizations doing regarding volunteers at the sites? Any thoughts? I presume it's being looked at, the panelists, I think, don't have any particular experience, it looks like.
We don't have a large volume of that kind of activity, no.
Yeah, we don't either.
Okay.
We have generally volunteer, events that are a day and a bunch of volunteers, and we're looking right now into what to do with them, which is probably cancel the event, so it's probably not going to be as much of an issue. You have some regular volunteers, but most of them are associated with the programs that we are suspending. So it's actually sort of taking care of itself because most of our volunteers are aimed at things we are suspending anyway.
Yeah. Okay. Omi?
This is for Cheryl. Can you tell us more about the stipend to staff and what it covers?
Yeah, this is Cheryl Du Bois at Bellwether, and what we've done is for our site staff, including maintenance and facilities associates that do cleaning, we've given them $75 a day, since they, unlike the rest of the staff, have to be on site supporting residents in a, during a time of higher risk. And we decided on a flat amount. We have some other local organizations who've done things like give people a 25% premium. But for equity purposes, regardless of the staff salary amount, we're just giving anybody who's working on site with residents a $75 a day stipend right now.
That's helpful to know. I think that will be, this is Lisa, that can get challenging to manage within budgets, I'm sure, but it's a great idea to be able to figure out how to compensate people who may have a greater need for that. So Cheryl, I think that's a really interesting approach.
Well, and again, we've got our local affiliates, our local funders agreeing to allow us to access operating reserves to cover excess costs. And even a few corporations agreeing to provide some help right now.
Mm-hmm.
Cheryl, this is Meg. I have a question on that. Are you, other than the janitorial staff, are you making delimitations of, is it everyone who is on site working directly with residents, or is it by job function, or how are you determining the stipend?
It's everyone who's on site working with residents. So that includes our cleaning, our maintenance, and our site staff. And as I might have said a minute ago, we've sent a letter out to all of our residents, and we've let them know that right now all of the staff that are on site are prioritizing cleaning and caring for residents. So our unit turns and our regular work orders are definitely going to be delayed as a result, because we're cleaning the sites and the common areas more often.
Very helpful. Is there another question?
In Seattle, what is happening with staff who live on site?
Did you hear the question? The question is, in Seattle, what is happening with staff who live on site?
Most of those, this is Cheryl Du Bois again at Bellwether, most of our staff who live on site fall into the categories that I just mentioned, so site managers and maintenance and cleaning staff. So they, they're following the same guidelines in terms of being available during the day for residents. We're having site managers work in their offices either with the door closed, or some of them have a Dutch door so they could have the top half open. And we've asked residents to communicate primarily through email and phone calls to staff, or by making appointments. So was there something more specific about residents or staff who live on site in addition to that?
That's how the question came in. So unless the person,
Susan Friedland.
oh, Susan Friedland, you're on the line. Did you have something more specific, or do you have also any other experience to share?
She said, no, that's fine.
No, that's fine. Great. This is terrific. This is great. This is Lisa. We haven't got questions at the moment. There may be others that come in. I have another one, and then some thoughts on the another bit of the discussion. I think one of the most challenging things, are things that we thankfully haven't yet had to deal with. Like, what if you have to kind of shut down a whole property or lock it down? It sounds as though from Cheryl's experience that the CDC will give us good guidance on that. So that is comforting. There will be someone who's helping with that. Hopefully they're not going to be stretched too thin. I think another one of the challenges that a couple of people mentioned is, how do you staff properties if either staff don't want to show up because someone's quarantined, or how do you end up staffing properties if the staff, your staff themselves are affected? And I don't know that there's any answer to that question, but maybe the question is more, are we starting to think about, in the event of a more urgent crisis where, I'm making this up, but you might have half a dozen staff people at a property and 4 don't come or can't come for some reason, what do you do with the rest? I know you have to manage with less, but I don't know if there's anything else beyond that we could be thinking about. Anybody have any thoughts on that?
This is Cheryl. I mean, we have discussed internally without, sending information out. There could be scenarios where there's a cluster at a property where a decision is made to close the property. And we're just going to have to deal, someone mentioned earlier, delinquent rent or rent payments. What if people can't pay rent? I think the coronavirus or the COVID-19, there's a number of scenarios where folks wouldn't be able to pay rent. I think the economics of the situation right now, some folks might not be able to work, and we need to be flexible, or closing down a property. Hopefully that wouldn't be our whole portfolio at one time, but we might have a roving task force, or we might have, coronavirus specialists, or, but I think, we can be prepared a little bit for what we don't know, but there's going to be scenarios where we're just going to have to manage through it, I think, and take it hour by hour, day by day, or whatever we need to do.
So I think my last question is around communications. A couple of you had mentioned that one of your first all resident communications has been pretty recent, like in the last day or so. And then in some instances, you've had targeted communications with residents in different circumstances. In general, is your plan and thought to be, there's a balance between, communicating with people so that they know what's going on, but not communicating so much to either burden them or alarm them. And I'm wondering, in general, is your approach or your thought to communicate with residents daily, every other day? And earlier, participant had the question about how you're doing that. Mostly it seems like it's flyers, maybe not email. So if you could just comment on what you think about the frequency of communicating with residents as this is unfolding, that would be helpful.
We have established a weekly schedule for our updates to site staff, and with interim.
TCB. Sorry, this is Stephanie.
Yes, I'm sorry. This is Stephanie Garrett from TCB. So we're communicating on a regular once-a-week schedule, and then supplementing that as needed. The guidance that we've given to our sites as recently as today is to convey this messaging to residents using sort of usual communications channels. And so with 120 some properties, that varies quite a bit. Some have almost sort of professional level, print slick newsletters that go out. Some have text groups that they use. So we're trying to allow site staff to use what they're used to relying on and what residents are used to receiving. But we are communicating on a weekly interval at this point.
Great. If there's no more feedback on that, and Omi, no more questions at the moment, I think.
One person just asked, by closing the property, do you mean the office?
So the question is, if you close a property, does that mean close the office and keep the property open, or close the property?
It means closing the office of the property.
Keeping the residents in the property.
Yeah.
Okay.
I would think that scenario would be a lockdown scenario where no one can do anything. So.
And in that case, the CDC would be quite involved.
That's right.
In managing the situation for you.
Or the local health department.
Yeah. Okay. I think that we're about an hour and a half in here. We set aside 2 hours. We obviously don't need to take it all. I would mention, I think Cheryl, and you said the words early on, that one of the biggest challenges here is kind of asking people to sort of settle down a bit, keep calm. Residents might have concerns and react, and a lot of the job, it seems, is to try to help people stay calm and settle in a little bit. That said, it's changing rapidly and is going to continue to change. So I know this is going to be a sort of in the moment experience where everyone is trying to do their best and learn how to deal with what they're faced with. We will hear it would be good to get feedback to know if this was helpful. If people would like to repeat this in a few days or a week. If you have particular questions or would be looking for some particular information, like on the resources front, again, you can email us. Please give us feedback about whether or not this is helpful. We did have 2 other things that we listed on the agenda as potential additional future discussions. One was more around the corporate response and policies. This was explicitly around like the properties and resident response. So if people are interested in learning more about what members are doing, each of them on the corporate side, we could host something around that. Number one. The second one, which I mentioned briefly at the beginning, was a couple people have mentioned that they have jobs under construction, and they're trying to think about what the protocols are for their jobs under construction, keeping the workers safe. What happens when you're facing material shortages because they're coming from China. That's a bit of a different discussion that we didn't, tee people up for today necessarily. But if those kinds of conversations would be helpful, please let us know. And if you'd like to repeat, check back in a week. Obviously, if this gets to be much more significant and dramatic, it might be helpful again to hear how people are handling more extreme cases and circumstances. But are there any other comments from people on the panel?
Only in that I think there was a question from, it looks like Kate Monter-Durbin, regarding the purpose of the stipend that Bellwether's offering. So maybe just because it was a question, I want to make sure that Kate feels comfortable with her answer.
That would be great.
Yeah, again, this is Cheryl Du Bois. We have, we've been focused on doing a lot of equity work and paying attention to where we have people disproportionately impacted by our practices and policies. And since the people who are required to be on site, cleaners, maintenance, site managers, are, in general, our lowest paid positions in the organization, and they're the ones that are most impacted by the critical need to support residents, we decided for that purpose, they don't have the privilege of working remote, that we would provide a stipend to those impacted employees, and also then encourage people to show up, even though this is a time where, some people are more anxious and nervous about showing up and interacting with residents.
Thank you, Cheryl.
Mm-hmm.
And Kate, hopefully that answered your question. So I think we don't see any more calls at the moment from the participants or the panelists. I know Manuel wanted to mention one thing, and I'll just note that in the spirit of that this is rapidly evolving. I know that in Massachusetts, the governor is in real time here making adjustments and what he's recommending companies do, including travel restrictions.
Right. He's declared a state of emergency.
Yeah. So that,
up to like 12 states with state of emergency.
And Massachusetts hasn't been one of the real hot spots, obviously. So things are going to be, the point in that is that things are going to be changing. It's going to be different, almost daily for a bit. So if this is helpful and people would like to do it again, please let us know. And meanwhile, I just turn to Manuel, who wanted to make a comment.
Just a very quick note on the resources, and hopefully you all got the agenda. And if you didn't, let me know, and I can get you the agenda, because Outlook works kind of funkily, and it was a little bit erratic at times. So I'm not 100% sure everyone got everything that I sent. But I provided a link in there to an IMA Coronavirus Alert Center, and IMA manages the captive insurance company that HPN has, which I think most of you know. We do that. Insures 25 member organizations, and they've done a really nice job in putting together an alert center with a lot of information. They were going to join us for this call, but unfortunately it coincided with a HYPEX board meeting, so that proved impossible. But and certainly if we do another call like this, we would have them on and maybe talk a little bit more about some of those insurance issues, which may be even more relevant next week than they are today.
So do look for that link. I think there's also a link to an article from the New York Times.
No, it was a multifamily executive article, but just mildly helpful. I mean, but it provides some links to that you probably already know, but I just wanted to draw attention to the IMA one more than.
Sure.
Yeah.
And again, Michelle, if you share your piece.
She did already.
Great, we've got it. And we'll find a way to get this links or get this material out to everyone on the call. So thank you to our panelists, to Meg, Monique, and Michelle, and Stephanie, and Cheryl. Really helpful. And, we're all hoping that this doesn't require another call, but if it does, we will be ready to hold it. So thanks so much to everyone on the call.
Thanks, everybody.
Yeah, thank you.
Thank you.
Wash your hands.
Thanks a lot.
Thanks.
Wash those hands.
Thanks. Bye-bye now.
Bye.
Bye.
How many,